Hello everyone. So in this video I am going to explain you about the leukemia. So in the leukemia, as we all know that we have the acute leukemia and the other one, that is the chronic leukemia. So in the acute leukemia and chronic leukemia, how we can identify that it is acute leukemia and chronic leukemia? So please remember that in the acute leukemia the blasts were more than equal to 20%, while in the chronic leukemia the blasts were less than 20%. So this is a basic rule that for the acute leukemia the blast was more than or equal to 20%, and in the chronic leukemia the blast was less than 20%. Now how they divide further, there is division of the acute leukemia and the chronic leukemia. So in the acute leukemia is divided into the ALL and the other type is AML. Similarly, the chronic also divide, that is in the CLL and the CML. So what do we mean by the ALL? So ALL stands for the acute lymphoblastic leukemia, while the AML stands for the acute myeloid leukemia, and the other CLL stands for chronic lymphocytic leukemia and chronic myeloid leukemia. Now first in this video I am going to tell you about the acute lymphoblastic leukemia, that is the ALL. So ALL has the two classification, that is FAB classification and the WHO classification. So in the FAB classification it is divided into L1, L2 and L3. L1, L2 and L3, and in this the FAB classification, please remember that the L1 of the FAB classification gives, it is the most common and it has the good prognosis, while the L3 of the FAB classification has the worst prognosis. Please remember it, that it has the bad prognosis. While the WHO classification divides the ALL, acute lymphoblastic leukemia, into B and T type, that is B type and T type. So here also the B type has the good prognosis, so it has the good prognosis, while the T type has the bad prognosis. The T type has the bad prognosis. So these were the classification of the ALL, that is the FAB classification and the WHO classification. Please remember which type is the most common and which gives the good prognosis. So L1 is the most common and it has the good prognosis, while L3 is the bad prognosis. Similarly, in the WHO, B has the good prognosis and T has the bad prognosis. Now on the basis of the prognosis, we have the certain factors on which we divide it into the good prognosis and the bad prognosis. So here I am writing the good prognosis and here is the bad prognosis. So what were the factors which has the what is the criteria which has a good prognosis and what is the criteria which has bad prognosis? So first is the age. So age 2 to 10 year has the good prognosis, while less than 2 year and more than 10 year gives the bad prognosis. So this is the first, that is age. So between 2 to 10 year age, the child has a good prognosis of the ALL, while less than 2 year and more than 2 year has the bad prognosis. The second is the sex. So female has the good prognosis, while the male child or the male person has a bad prognosis. So female has a good prognosis. Third is the FAB, and FAB classification I already told you, L1 gives the good prognosis while L3 has the bad prognosis. Similarly, in the WHO classification, the B type gives the good prognosis while the T types gives the bad prognosis. BALL gives the bad while the TALL has the bad prognosis. And the genetics, so in the genetics we has the hyperdiploidy and hypodiploidy. So hyperdiploidy has the good prognosis, hyperdiploidy has a good prognosis, while the here is hypodiploidy has the bad prognosis. So hyper and hypo has the bad prognosis. Now in the ALL, the most common genetic abnormality in the ALL. So hyperdiploidy is the most common genetic abnormality in the ALL. So please remember it that the most common genetic abnormality in ALL is hyperdiploidy. And in the FAB classification, L1 has the good prognosis while L3 has the bad prognosis, and the TALL has the bad while the BALL has the good prognosis. So these were the prognosis chart which has the good and bad. Now next is the acute myeloid leukemia. So next leukemia is AML, that is acute myeloid leukemia. So in the acute myeloid leukemia also we have the classification, that is also the FAB classification. So this is a very important, please remember it by heart, that here is also the FAB classification, and in this we have the stage from M node M0 to M7. Please remember it, it is very high yielding table, because so many questions I pick up from this table about the M node from the M0 to M7, that is the AML classification. So I am telling you the most important questions about the particular stage. So in the M node, so here is M node, M1, M2. So till now there was no question asked from the M node or M1, and from the M2 the 3 questions were asked from the previous year, and the first question that was asked is that M2 is the most common. So the most common from the M node to M7 is M2, and in this we see the translocation. This is the second question. What is the translocation seen in M2 AML? So in M2 AML, the translocation we saw is 8:21. 8:21 translocation, and this is the M2 AML in which we see the chloroma, and chloroma means that the AML is present in the soft tissue. Chloroma means that AML is present in soft tissue, or in the chloroma, particularly in the orbit, most commonly in the orbit. That's why it is known as chloroma. So if the AML is present in the soft tissue, particularly in the orbit, then it is known as chloroma. So most common M2 translocation 8:21, and here the chloroma is also seen in the M2 AML. So these were the 3 questions about the M2. Now let's move to the M3. So from the M3 also the 4 questions were asked. So in the M3, first we have to know what is the other name for M3 type AML. So in the M3 AML, also known as, please remember it, it is also known as APML, that is acute promyelocytic leukemia. Please remember it that it is also known as acute promyelocytic leukemia. So why promyelocytic? Because here the promyelocytes counts were increased. Promyelocyte count is going to increase, and it is seen as a ore rods. So it is seen in the cell as a ore rods. So ore rods were seen, and when collection of ore rods is present, then it is known as phagoid cells. When collection of ore rods were present, then it is known as phagoid cells. So here is my first question about the M3. So the first question is other name for M3 is APML, that is acute promyelocytic leukemia. And in this stage we see the phagoid cells, and also we see the ore rods. So ore rods were also seen in the M3 AML. So this is the 3 questions till now, that ore rods or phagoid cells or the other name for M3 AML. Now my second question about M3 AML is, in this the translocation 15:17 is seen. Please remember, in this PML RARA translocation is seen. PML RARA translocation is seen in the M3 AML, that is translocation 15:17, that is PML RARA. Please remember it, it is also a very high yielding question. Now the third question which was asked in previous year question is that tell me the only leukemia which is associated with DIC. So M3 AML is the only leukemia. So it is the only leukemia which is associated with DIC. Please remember it. It is also a very high yielding question, that it is the only leukemia which is associated with DIC, M3 AML. And the last question, which also a previous year, for the treatment of M3 AML is ATRA. Please remember it, that is ATRA. And the full form of ATRA, as we all know, that is all transretinoic acid. And in this we did not give the chemotherapy, so chemotherapy is not given here. So chemotherapy is not given. Please remember it. So these questions were about the M3 AML, that is other name for M3 AML is APML. Translocation 15:17 is seen here, while in the M2 translocation 8:21 is seen. It is the only leukemia associated with DIC. For the treatment of M3 AML, ATRA is given. So these were the questions about the M3. Now move to the M4 AML. So the for M4 AML, the most important question is that in this we see the inversion 16. In this we saw the inversion of 16, and inversion of 16 is also seen in the M5 and M6, then M7. So M4 inversion of 16 is seen in the M4. Please remember it, inversion of 16 is seen in the M4, and M4 and M5 is also known as tissue infiltration. Please remember it, that it is known as tissue infiltration, which is seen in the gums and skins. Please remember it, that tissue infiltration is seen in gums and skin, and the inversion of 16 is only and only seen in M4 AML. How we remember it? 4 4s are 16. So here the inversion of 16 is seen in M4 AML. Now the last question which was asked about this classification is about the M7, because M7 is the least common. So first question, it is least common and it is associated with Down syndrome. It is associated with Down's syndrome. So please remember it, that it is associated with Down syndrome. Now out of all these, which AML gives the good prognosis? So please remember it, M2, M3 and M4. In M2 translocation is 8:21, while in the M3 translocation 15:17 is there, and in the M4 translocation 16 is there. As we for 16 is there, M3 translocation 15:17, and in the M2 AML translocation 8:21 is. So all this gives a good prognosis. Good prognosis. Please remember it, that good prognosis is in M2, M3 and M4. So this is all about the AML and ALL. While in the next video I will tell you about the CLL and CML. Till now that's all for today. Thank you. Bye bye guys.